what's changing in your practice?
Well, what's changing in the practice is, number one, we have always cared about patients, and two, and part of the reason that I switched over to the concierge approach to medicine, I still run the entire practice, so 3,500 patients plus or minus, and 200 to 300 are in the concierge portion that I take care of directly, but supervise the care with nurse practitioners and other physicians of the remaining number of patients.
I see.
And so the same message is being delivered in a consistent manner.
I see. So the concierge, and can you describe a little bit what some of our listeners might not know what concierge medicine is? What's different with the concierge medicine approach versus your traditional, if you will, practice?
So what concierge medicine does is basically for a fixed fee, and depending upon and that fee can vary anywhere from $2,500 to $12,000 a year, and depending upon the population and the services offered, and the number of patients on the care. What that allows you to do is to give you the time to spread out and really do all the things that you know needs to be done. We have always delivered that level of service. The main difference now is that we are able to charge for that. Previously, we did not. So that long wait times were a big problem. The concierge service allows us to schedule patients much more equitably, allowing time to deliver the message. And this is in part driven by the fact that the insurance model is not designed to allow the time necessary for health education. And most of disease exists because of lack of education.
Yeah, I was hoping we would get to the insurance piece. I mean,
here we are.
Here we are. So is it about the insurance industry that have created a system, to your point, that doesn't allow you to spend enough time with your patients to have the conversation about what they're eating and drinking, which is a huge proponent of health, to your point? Is it all about that insurance industry that's forcing physicians like yourself to just line them up and bring them in every 5 or 10 minutes? Is that the problem?
Well, that is actually part of the problem. You either run at a loss, and you can't support a loss for very long and still stay in business, or you find other ways of financing the practice. Financing the care, financing the education of your patients.
And hoping to get a big royalty from a podcast you're doing, maybe.
And hoping to get a big royalty.
You'll have to keep wishing. Keep wishing for that,
might
Dr.
not
Bowen.
come. but still, the fact is that getting the knowledge out is important. And but the one point that we all miss, is the fact that we're all in this together. And the real problem is the total cost of care. We're spending between 18 and 27% of the
GDP.
Of the total GDP on health care.
Yeah, that's outrageous, isn't it, compared to the rest of the world?
It is outrageous, but what that tells you is the amount of free cash available to finance good care.
Yeah. Dr. Bowen, please go ahead. I'm sorry, go ahead.
Yeah, well, I'm basically, and the question is how you, as the developer of an educational podcast, should be part of this system, and how do you design a system to allow this to be paid for by the revenue spent. This is straight out tax revenue and insurance revenue spent in delivering care.
So if I hear you correctly, it's up to us, the voters,
Yes.
to find the politicians or to find the legislators that are supporting something like value-based care, a change to the system where, to your point earlier, you're getting paid on the health of the patient instead of the sickness of the patient. Is that what you're suggesting? Is that what we should?
Yeah, so value-based care goes in that direction, but what I'm trying to say is all contributors to value should be rewarded. And you, and with this podcast, being a contributor to value should be somehow part of that equation.
I see. I see. So getting the word out, and letting folks know about this issue. What about from a patient perspective? I mean, our hope is this podcast will be watched, not just by the healthcare leaders. They don't necessarily need another podcast, but it's the folks that maybe are not aware of some of the topics. So I guess what you're saying is the hope is that more folks will listen to this podcast. Maybe we can get around an initiative or a public service campaign or so forth. But we've got to change the system. It sounds like you're saying the system is skewed in such a way that it created this problem. And we're not going to be able to fix the problem unless the system is drastically changed and rewards good health instead of rewarding sickness. Is now the time to do that? Do you think with COVID, do you think with the social awareness of, say, the George Floyd situation, do you think the time is now that we can do this?
The time is getting forever pregnant. The question is when the delivery will happen.
Spoken true clinically. Yes, go ahead.
Right. So that it is not sustainable. And the fact that it has been sustained just tells you the resilience of the population. And but when the perfect storm of global warming starts to drive up the total disease incidence, that is when great change will happen. In medicine and in healthcare throughout the ages, the greatest health actually comes during times of war.
Really?
When calories are restricted, diabetes goes away.
Interesting.
When you really have to work hard, you burn up calories. So that many things happen when the system is grossly stressed. And global warming, with all the drama that it is bringing, I think will be one impetus to really make a significant change.
How about COVID? Do you think, Dr. Pone, do you think COVID shined a bright light on this issue? Because wasn't it, and please correct me, but wasn't it the patients that you described earlier, the ones that were getting the sickest and flooding the hospitals and overrunning the emergency rooms, the folks that did not get the preventative care, that had high blood pressure, that had diabetes, undiagnosed, many of them? Wasn't that a red flag to the healthcare system to say, listen, this is not sustainable? To your point, look what happened during COVID. Could that have been a shot across the bow of the healthcare system? Was it enough? Was it like a war that you described?
Well, the COVID, I don't know that COVID was a shot above the bow of the healthcare system. I think it was a shot, and it was a shot that was well monetized.